Good evening, everybody. It is exactly 7:30.
He wants to go home.
Bye now. It's now 5:30, so we'll kick off the meeting. Big welcome to everybody. Just a reminder that the meeting is being broadcast online and it's being recorded. And the recording will be uploaded onto the ICP website after the meeting, and a version with British Sign Language will also be produced and uploaded. In welcoming people, I'd like to, I can't see where he's gone, I'd like to welcome Phil Hall, who has taken over as the acting chair of both Kingston Hospital Foundation Trust and Hounslow and Richmond Community Healthcare. It is a. I think there might be plans there, Phil, in terms of that. But a big welcome and thank you for stepping in. Also, what I should have said when I announced this was being broadcast is if members could use their microphone when speaking for the benefit of people at the meeting, but also to facilitate the recording of the session. If any members of the public or anybody else requires it, a hearing loop is available, so please do make yourselves known. This is a meeting which is being held in public. It's not a public meeting, but we will have time for questions at the end of the meeting. We will do our best to avoid jargon and acronyms, but a glossary of terms is available on the website. And apologies for this meeting. We've had apologies from Joe Farrer, Richmond Place, who's the Chief Executive of Kingston Hospital, Hounslow and Richmond Community Healthcare, Mike Jackson, who's Chief Executive of Richmond and the London Borough of Wandsworth, Douglas Flint, who is one of our provider chair representatives from the Royal Marsden Hospital Foundation Trust, Carol Cole, who's a provider chairs representative and is chair or chairing Central London Community Healthcare Trust, Anna Popovici, who's the Director of Children's Services, Councillor Peter McCabe from Merton Health and Wellbeing Board, and Councillor Sabah Hamad, who's the Chair of Kingston Health and Wellbeing Board. I think that's all of the apologies. It does look like we've got a fairly full house apart from that, Ben, and I'm very happy to confirm that we are quorate for this meeting so we can proceed. If I could just check that any declarations of interest for the meeting, if people have any additional ones other than on the register. Can we note that Brenda Scanlon has updated her declaration of interest since the last circulation of papers, and the register has been updated. A reminder to any member of the ICP, please do check your entries on the register and do let Ben know if there are any changes, additions or deletions in relation to your declarations of interest. We'll move on to the exciting part of the agenda, which is to look at the minutes of the last meeting. And I'm sure that you've all read them thoroughly and enjoyed them thoroughly. Can I check that everybody is content to sign those off as a true and accurate record of the meeting? Yep. I see no dissent, so fantastic. We'll sign those off. All of the actions on the action log are closed, so we can move on to the first substantive item on the agenda, and our Deputy Chief Executive, Karen Broughton, will speak to this. Karen, if I could pass across to you.
Thank you, Chair. Good evening, everybody. The purpose of this paper is to update the board on the development and the delivery of the priorities that we all agreed as part of the Integrated Care Partnership strategy in September. What you have in your packs, and there's lots of information, so apologies for the amount of information. We will have routine reports on each of the delivery programmes. But just so that you have an understanding, we've got a delivery plan for each of the strategic priorities up until the end of March. And the board's direction to the work streams previously was to try and concentrate on a small number of things and do them well. And therefore, hopefully that's been reflected in the programme plans that you see here today. We also have draft terms of reference for each of the ICP subgroups, because those groups will oversee the delivery of the plans on behalf of the board. And we also have a highlight report for each of those strategic priorities, not only outlining some of the risks and the issues that those work programmes see, but also the mitigations that are taking place. Within the updates, there are outputs and outcomes that are identified. I think to be kind of honest, there are probably some more work that we need to do on there. They are developing. We saw a framework and we agreed a framework as a board, but actually the detail of that will still be being worked through over the coming weeks as we go through that with programme leads themselves. I think the other thing that's been happening since we last talked about the strategy at the board is the delivery of the investment fund. Remembering it has two parts, has a health inequalities aspect, also have a delivery of the priorities aspect, and there's an update in the paper just where we are. We plan to bring a further report back in the April meeting of the board to share with you the investments that are being taken forward as part of the delivery of the strategy. Excuse me. We've also been talking to sponsors, so remembering that the board agreed that we would have a sponsor on the board for each of the work programmes. They have been some conversations with sponsors around the work programmes and also the role of sponsors, and there will be ongoing conversations in relation to that. When we get onto the forward plan later, you will see that in order to not only have highlight reports back, we have agreed as a board that we will also have some more in-depth items to talk about. So to have a kind of a deep dive into some of those work streams at each meeting. This time it's health inequalities with a focus on a healthy weight, but you'll see that actually we've programmed into the board much more in-depth conversations around the delivery of those programs, so we can have some more information with those as we go. We also put in the paper the important work that guides us in relation to our partnership with Healthwatch and VCSE alliances and the people that are being put forward to groups to help us make sure that that's embedded in what we do. And I think probably that's enough for now, only to ask the board to note the work that has happened, to thank those people that have been involved so far, a massive amount of work from a lot of people across the system to get us to where we are today, and also to agree those draft terms of reference if everyone's happy with those. Thank you.
Great, thank you for that update. I'm very happy to take any comments on that. It is just an update in terms of where we're at. But it would be useful to get your views as to whether or not it would be good to, as proposed, bring back deep dives into the work stream so that we can keep a proper check on things. Gillian.
Thank you, Mike. So I just wanted to acknowledge the enormous amount of work that's gone into this. It's pretty impressive, really. So a big thank you and well done. If I've got a worry, it's whether there's too much there, which may sound an odd thing to say, given how the fact that we want to be ambitious. But I'm just conscious of how much everybody's got on and the resource constraints under which everybody's working. And so I'm just leaving the question, really. I think we need to see this as an iterative process, really. So there'll be time to come to a view on that. But that was my general feeling when I was going through the paperwork, thinking just how comprehensive it was and how much had been achieved in a short space of time. And then I had a very specific question on the children's one. Is that okay, Mike? Very much so. And it's in relation to dental health, which is something I feel really strongly about, and I was very pleased to see it there. But what I missed, and I may have missed it because it's there, was any sense of the kind of coverage that we have in South West London, and whether we know that there are particular parts of the patch, and whether these are related to health inequalities, where there isn't good NHS provision. And I didn't get a sense of that. I might have missed it because there was a lot there, but that seemed to me to be kind of a key starting point, really. And I don't think NHS services are perfect, but we know that they are a kind of basic building block upon which much can happen, and without them, people are really, really troubled. So it is a specific, but I think it's kind of quite a useful thing for us to know. Thank you, Mike.
Thank you. So Karen, do you want to say a little bit about dental, but then maybe some reflections on the scale of ambition?
Yeah. So Gillian, I think, so why don't we take the question away? Yes, there are particular issues across South West London. We can bring that back and share that with the board at particular points in time. The ICB, the Integrated Care Board, is taking over responsibility for dentistry, so it's a new responsibility for us. So we can bring that back. It won't be in the report, but we can certainly bring that back. In relation to scale of ambition, it's not the first time you've asked us that, is it? Just be realistic and to make sure that we do a small number of things well. We can certainly go back again and make sure that people aren't over-delivering or trying to over-deliver and actually be much more realistic. So we can just keep that as part of the conversations that certainly Rachel has with each of the work streams to see that they are really deliverable. But I think it's a challenge that we probably need to keep you asking us to make sure that we collectively deliver the right number of things and don't try and spread ourselves too thin.
It struck me that some of the work streams have got more activity than others. And the one I know best is the one that John and Iona are leading. And I think my feeling is we've pitched it about right, but that's maybe because I'm more involved. So that struck me as I was going through the paperwork. Thank you.
It may be that we ask the leads to reflect upon that as well, Karen.
Why don't we? And I would just say, Julian, some of those work programmes are much more developed and have a stronger background than others, so it's probably why that you see difference as well.
I'm sure it'll change.
Yeah.
Around.
So I'll bring in Brenda and then Yemisi.
Thanks very much. It is actually a really detailed plan. Well, all the work streams are very well detailed, I think, even at this stage. And of course, one of our main foundations is the workforce one. So I hope this doesn't sound too parochial a question, but when I was going through it, I'm looking at Sam, but there may be others as well. I see that there is an event planned in March this year for local providers and employers, which I think sounds excellent in the sense that it probably, I don't know, but does this build on what we already have, or is this going to take a new tack in terms of how we try and support our multiple providers in how we, if you like, tackle some of the workforce issues? And then it's an ancillary question which may not be relevant, but I'm also interested in the extent to which in South West London we know how challenged or not we are in terms of some of the recent issues around modern slavery, which of course has come up mainly in the independent sector around providers. So I hope that those questions are relevant, Mike, so thank you very much.
So Carolyn, can I bring you in on that? Thank you.
Yeah, so I mean, Sam may want to say, oh, Carolyn, sorry.
Yes, thank you, Chair. So in terms of the first question, we're very much building on the infrastructure that we have and supporting organisations that we already have working in this sphere. So we're trying to do things differently, but engaging very much with the communities that we already work with. I don't think we've really thought very hard about modern slavery in this context. Others might want to correct me, but we haven't really got any actions in this work plan to address that.
Do you want to add anything, Karen?
So I was just going to add that we are thinking about an event to bring everyone together to share what's going on apart from anything else. We had a really good session as a kick-off kind of session for the work stream where we met representatives from all of the organisations, local authorities, voluntary sector, job centres, all those kind of organisations to say how do we best work together. The March event, and Sam may want to say more, is designed to do exactly that, to continue those conversations, to look at where we'll invest and to see how actually we create more together by working closer together.
Sam, did you want to come in?
I'll just add quickly. So the event in March is, as colleagues have said, there is a lot of existing activity in our communities, particularly around employment support, working with communities, and it's an event that's going to be run by our Integration Hub, which is part of South London Partnership, and it's to bring the existing people together with the people who are new to this area, particularly from this work stream.
Thank you for that. It was good, very good point, Brenda. If I could go to Yemisi and then I'll come to you, Dino, and then Nick.
Thank you, Chair. I agree with others who have talked about the ambition and the progress we've made so far, and well done on what we've managed to achieve. And it wasn't particularly clear to me in the update. So and the thing that slightly concerns me is the standardisation and triangulation between the different work streams, and ensuring that as we develop things further, we ensure that actually that there is a level of standardisation, because otherwise some work streams might be so far ahead of the others. So, for example, I'm thinking of the board sponsors. At the moment, it's very vague as to how they champion that partnership work, and it would be good if maybe there were certain guidelines, or we could share that information amongst the different work streams. I think that would be helpful.
I'll come back to you for final comments when we've taken a few more. Dino.
Thank you, Chair. Again, wanted to sort of congratulate really on the strategy in terms of its comprehensive nature, noting obviously the main risks to delivery are capacity, and would fully support the comments that have been made around each programme, looking at what can realistically be delivered in relation to the current resource on an iterative basis. So that point's been covered. I had another point, and maybe this links to an item later in the agenda as well, around given the need for programmes to have equality impact assessments, really it might be an opportunity to actively promote actions that are linked to the anti-racism commitment through that in the strategy that we're discussing later on.
That's an excellent idea, Dino. Perhaps we could, that may be one for you, Sarah, to reflect upon when you come to your presentation in an hour or so's time. Nick.
Thanks. Firstly, I want to echo Jemsi's point about collaboration and coordination between some of these. There is certainly overlap in some of them. Just wanted to ask about the ICP Priorities Fund and Health Inequalities Funds. I see that there's an update planned for April on that. I also saw there was 174 applicants so you can see the kind of amount of work to go through all those, and the number have been identified. In Kingston, in our Place Committee last week, there were a number of colleagues who were concerned and a bit unclear about the time frame through some of those applications, and particularly things have been approved, whether there's any clear idea of when funding might be available, as there are individuals, who've got contracts perhaps till the end of March, and, here we are nearly in February. People would really appreciate some clarity on timeframes. Thank you.
Really helpful, Nick. So particularly, Karen, if you could focus upon how we might make sure that we're managing the overflows and the. Oh, sorry, is that Zara? Zara, yeah. Bring you in, and then I'll come to Karen for concluding remarks.
Of course. Thank you. Just adding on that, I was going to do exactly the same point. I was going to make exactly the same point. I know specifically in Kingston, some of the voluntary sector organisations that got extension, the kind of existing projects under the Health Inequalities Fund are waiting to understand exactly, for a contract, actually some written agreement rather than, informal agreement on the continuation. And I think since we're in February, it's quite clear that we need to move quite quickly. But also I think within the voluntary sector, a lot of groups are asking to know who got the award and what exactly they are going to deliver, to work collaboratively with them. But also, I guess, it would be really interesting to see what elements of the plans, which are quite, amazing and very detailed, super useful, this new project, will address and will help you to achieve.
Thanks for that. You did make me panic then, though, when you said we're in February, and I thought, we're not, are we? We're not quite. We're only a week away, so it's the point is still really, really well made. Thank you. Karen.
Shall I just come back on those then? So just in terms of consistency and kind of overlap of programmes, We meet with the executive sponsors to make sure that we talk across programmes so that actually we're not just looking at siloed ways of working. The next one of those is next week or the week after, I think, isn't it, Rachel? So that's one of the ways that we're going to try and do that, but keep challenging us, I think, for that, to make sure that we don't, because, you know, as we've said, we don't have the resources to kind of, you know, make sure that we're doing things double. So that's one of the ways that we try and make sure that the overlaps of programmes and consistencies are the same. It may take us a little while before we get there, because actually this is a process that we're starting from scratch. I think the role of the sponsors, I think it's new, and we'll have to keep working together on that. But if we talk, maybe we can talk a bit outside about how do we make sure that we share that, and how do we make sure that we're all working in the same way on that. And if there's things that the sponsors need, then let's make sure that we do that as well. So maybe I'll have a follow-up conversation with the MSC. In relation to the investment fund, there are two parts to it. There's the Priorities Fund, which supports the delivery of the strategy, and then there's the Health Inequalities Fund. I'll get John to talk about the Health Inequalities Fund, which is the bit that Sarah was talking about. In relation to the Priorities Fund, we are at the end of that process. There are two other bids that we're just looking at the moment. We are in the process of producing a report on that. We'll bring that back. We'll absolutely link it, Sarah, to the work streams to make sure that we can see easily what's going to make a difference to each of the delivery programmes. And then we have already, in this part of the process, we have already fed back to the people that have been unsuccessful, and things like the session in March that Sam's talking about is to try and bring those people together that are working on similar but different programmes to make sure that we're all talking the same. So I think there's three bits for the priorities part. We'll get the final two reviewed and seen, and then we'll do the report to the board next time. We'll make sure that that links and that we can clearly see those investments that go to each of the work streams, and then we'll talk in the work streams about how do we then make sure that people that are working on similar but different programmes are working together. John, did you want to say anything about the health inequalities?
So, thank you. So, I checked with the team today just to see where we were in the process, and my understanding was that those successful bidders had been made aware before Christmas that they were successful, and they've been communicated to. And what's happening at the moment is the final signing off of something called the purchase order stages. So there's I'm sorry if there's been any confusion and people wondering or worrying if they're getting the funds. It's absolutely coming. We have committed to it for this year and for next year. So if there's any particular cases you just want to raise with me, just have a chat with me after the meeting, and I'll just sense check with the team just to make sure nothing has fallen between two stools. I don't think it has, but happy to have a look if that's the case, particularly for Kingston.
Thank you for that. I'll pass to my co-chair for some final comments, Ruth.
Thanks. We're enjoying the fact that we're actually physically in the same place as co-chairs. We think it's the first time we've managed to make it happen, so it's all very exciting. I'm really struck by what Gillian said and then Brenda's point about modern slavery. We need to be realistic, we need to be pragmatic, we need to recognise we can't solve everything. And so I think the idea of focusing on certain areas where we can actually shift the dial and make a difference is really important. But Brenda, you're absolutely right. Then issues like modern slavery come up and we don't want to lose them. My thought is that because this is an integrated system, we need to think outside of what we're doing within the partnership and the board, because we have the place boards, we have the health and wellbeing boards, we have a lot of work that's being done by the local authorities. So I'm thinking that maybe when specific issues that come up, like as you've just done, Brenda, with modern slavery, which is really important, rather than saying how are we going to try and fit this into the work that we're doing, why don't we go and have a look at the work that the 6 boroughs are doing anyway on modern slavery, and ensure that the place boards are aware of that work and we can start to integrate it rather than adding it in on top, because I think we just need to recognise that it's not going to be possible to deal with it properly. But there is a huge amount of work going on anyway, and it would be foolish not to try and bring it all together.
Brenda.
Thanks very much for that. I think the reason I raised it is because if we're talking about workforce, which of course we are, one of the most important sectors is the independent sector, where we do know that, in a sense, we need to grow and sustain and, I'm going to use the word, develop and empower the workforce there. And because at the moment, modern slavery has come up as an issue, perhaps to a degree I mean, it's in the media, so we all know about that, and we all know that there are places and organisations that have been affected. So I think it's just considering that within the context of an event that's taking place. And so it certainly, if I may say, wasn't to, in any sense, not take account of the very good work that's going on in most local places around this, but it was actually thinking about, it's one of the foundation stones of workforce, is how we are going to grow that sector, and independent organisations are often key parts of that. So that was my thinking. If I wasn't clear, I apologise. Thank you.
Thank you, Brenda. It was a very good point to make. We'll now move on to the next item on the agenda, which is one of our in-depth focus sessions, and this one's on prevention and health inequalities. We're looking at healthy weight in particular, John. So over to you and your team.
Thank you very much, Chair. So, just to pick up on Gillian's point about the complexity of some of the delivery plans that we've got, and I'd have to say as an SRO, I look at these delivery plans, I recognise that we're spinning lots of plates, and I understand that we need to do that, whether it's from a health or local government perspective. So whether it's immunisations, we might want to talk about measles, or whether it's about cervical screening. I see my public health colleagues nodding their heads, but there's an endless list of stuff which we'd like to do better on. But it would have been interesting or difficult perhaps just to bring a tale of woe. So we did think about why we would want to talk about healthy weight. And we're deliberately using the phrase healthy weight as opposed to obesity. Not just because of the cost of living crisis, where actually malnutrition is an issue. It's been an issue for a long time, not just in South West London. So we need to think about a healthy weight in its broader sense, not just to focus on obesity, but we can tell you from a healthcare perspective, obesity is a huge driver of some of the costs. So we've got to be clear about that. We didn't want to talk about healthy weight just to sense check where you all were in terms of your New Year's resolutions. If you're anything like me, it's probably headed south a long time ago, and I haven't even mentioned damp or dry January. So we've decided we'd just talk about healthy weight. Perhaps do some of the myth busting about healthy weight, in particular around the New Year's resolutions, because that links into the idea that this is all about willpower. And what Catherine has sort of presented in the slide deck here is just a little bit more complicated than that. And in being a complicated topic, it risks being overwhelming. And if it risks being overwhelming, we almost think from an individual, organisational, personal perspective, there's nothing we could do about it. So we're going to do a little bit of advocacy here, talk about a little bit about reasons for optimism, and then as we get into the conversation, just ask ourselves, is there more that we could do, or do we really agree this is something that can make a difference? Not today or tomorrow, but 5 years or 10 years' time, which is hence why we're bringing this here. So there's a whole load of things we could have brought. Healthy weight is linked to health inequalities as much as anything else is, but we feel, talking to the directors of public health, my team, that this is an area where we can actually coalesce around because we can all see it's been important, but it's not just a health-related issue. So I hope I haven't stolen your thunder, Catherine, and I'll leave the floor to you as you go through the slide deck, and then myself and Iona will happily lead a session after that in terms of questions and queries.
Great, thanks John. For those of you who don't know me, I'm Catherine Heffernan, Director of Health Improvement at the ICB, but also I'm South West London Public Health Consultant, so I straddle across local authority and NHS. So I'm not going to take up too much of your time. I do not have a surprise guest, so... I'm going to assume you have read the slides and you're ready to discuss. So I'm just going to give a couple of headlines. Picking up on what John just said, healthy weight is actually a very, very important issue for us in South West London, not just because it's a priority in our strategy, but also to having unhealthy weight is a huge risk factor for a huge number of conditions, as you well know, cardiovascular disease being one of them, but also too, there's huge disparities across our demographics within South West London in relation to healthy weight. For example, in our most deprived areas, we will see much higher proportions of people with above healthy weight, or what people will call obese or overweight. So really, it's one of those things that if we tackle and get right, we can actually do a lot of improvement across the board by just focusing on one area. So like I said, I'm not going to go through every single slide. What I'm going to pick up on slide 6 is that there has been for a very long time this idea being that if you eat less and you move more, you will have a healthy weight. And then there was a real shift then in understanding that actually it's far more complicated than that, and we live in this obesogenic environment, which is actually quite a difficult word for me to pronounce. But if you look at that picture, people go, oh my goodness, there's nothing I can do about that. I understand that it's very complicated, there's lots of different causes, but actually looking at that, I don't know what it is that I can do about it. But there is a way of doing it, and that's the systems thinking approach, and that is the work that we're hoping to take forth in our Health Equity Partnership Group to do something. So through that, everybody can work together to actually do something about improving healthy weight. There's a few slides there, a snapshot of where we are in London. Worrying, we do have an increasing trend of our 10 and 11-year-olds who are above healthy weight. Whilst the estimates of adults are not too bad compared to other parts of the country, you'll see there that there's a big difference between our boroughs and indeed within our boroughs in relation to adult healthy weight and children's healthy weights. So, and again, it's an issue that's increasing. There's also a slide there, number 9, reflecting there, taken from our Health Insights, that actually adults aged under 30 are 35% more likely to be obese in the core 20+5 areas compared to other areas. And this proportion slightly decreases as we go up age groups. This is actually worrying in a way because perhaps this is indicating there's a trend of our younger generations being more likely to be on healthy weight. You'll see there too that a large proportion of our patients on the QOF registers are overweight or obese who have a number of different conditions such as diabetes, hypertension, etc. There is an awful lot that is already going on. There's a lot happening in place. Public health teams across South West London have put an awful lot of initiatives in place. Local authorities have a lot going on. No doubt voluntary sector does too. There is an awful lot there. However, there is something there about how do we link it all up? How do we do more joint working at a place level? Also, too, we have the introduction of the obesity drugs, which, of course, is going to throw a cat amongst the pigeons, if you excuse the expression. So that is something we do actually have to take on board in our planning. There is some stuff there to discuss further from slide 11, other things that we could be doing in place, what education could be doing in helping, not just healthy schools, but in fact healthy nurseries as well. There is a growing trend of toddlers being used to sitting in their buggies on devices rather than running around. So from the very start, there's a lot that we could be doing. Safer neighbourhoods, of course, and designing our homes and our neighbourhoods to be more conducive to healthier lifestyles. So moving on to the NHS, again, we have an awful lot that we are doing across South West London. We are implementing, or have been implementing, the Digital Weight Management Programme, as you know, and we are actually one of the top 10 referring ICBs. We've also too been implementing the low-calorie diet, and as well as our own South West London homegrown Penthalon and Decathlon. We've also been doing weight checks in community pharmacies, and also too there's been health and well-being checks happening in the community too. However, we don't have any South West London commissioned Tier 3 service, and we've got some work to be done around that, and that is actually in our delivery plan for prevention. Much more we can be doing. There's some examples there for primary and secondary care. Not putting you on the spot, it's just to throw out some examples. We could be doing a lot more around active hospitals. There's a lot of evidence to show too that if we've got active wards, we can actually reduce hospitalizations by a day and a half. There's a lot going on elsewhere in the country that we could draw on and actually really fully embed in South West London through the moving medicine. For primary care, we can have active practices, and I know that this is something that's been picked up in Sutton. Again, there's a lot of evidence around that. And one such statistic is that 1 in 4 people are more likely to be active if advised by a GP or a nurse. So much more we could be doing there in primary care. A lot more we could be doing in the workplace. We could be having a walk and talk meetings, making it a lot easier for people to take breaks and eat healthier and move more. So lots for discussion. But one of the things I kind of want to throw out, and I hope I'm not going to be in trouble with John over this, is that to try and move away from what we should be doing and let's pull together one group of people who's going to do all the work to what can I do in my part of the system to make a difference, and that each one of us in each of our parts of the system together will actually bring about change. So last few words from me. You have the governance structure, which you've also seen earlier in the plans. But one of the things we want to bring to here is how we're going to embed prevention across South West London, and to hope that the ICP will endorse this. This is the prevention principles which the public health teams across South West London have come together and have devised. And hope that this is something that we will embed in all our services, in our plans, in our meetings going forth. And on that note, I'm going to hand over to Iona and John and ask the ICP to discuss our suggested approach and to agree our proposed prevention principles. And last thought, think jigsaw, so we all have a part to play in the system.
John, did you want to make any concluding comments?
So, just to say, this has been worked up between ourselves and our colleagues, directors of public health. So, perhaps Iona, if I did the intro, if you just want to sort of bring that all together, otherwise it just feels a little bit healthy.
I think for me, it's partly echoing that we started the meeting saying how much is in the collective plans, and I think the art, converting the science into the art, is how we make this a priority for everybody, right through to the frontline workforce, how it becomes part of a conversation with patients, with residents, but also how it's set in a context where healthier choices are the easier choices. They aren't the more expensive choices, they are the readily available things. So that environmental piece, which is clearly where local authorities' places become so important with our green spaces, our green spaces and our licensing objectives, and all of those things need to be congruent with the overall aim as well. It is what happens in our nurseries and schools, but it's very much what happens when anybody sees somebody else and has a conversation. There has to be time for that holistic approach, that being active, talking about smoking, all of those things are part of that, what's important for that individual too. That it shouldn't just be the condition that they've come in to talk about today. There needs to be seen in that context, the family context, the environment they live in. Because I think when we lose that, we lose a lot of the opportunity to affect that change, offer that advice, offer that signposting through to what's available locally. It fits with our primary care, social prescribing model. Lots of people can go and find out, but others people need more help. So changing that culture that it's important to look at holistic health, not just only focus on the presenting condition or the condition they're here to talk about today. So trying to change that mindset, I think, will be vital for this to be successful.
Iona, Catherine, John, thank you very, very much for that presentation. We will move to the discussion. I'm looking at Dino, hoping that he might want to say something about the healthy practices approach that's been flagged up. But I'll come to Graham first, which gives you a moment to think about it, Dino. And the answer isn't, no, I don't want to say anything.
Hi, thanks. For those of you whose eyesight is... Excellent, great. For those of you whose eyesight isn't superlative and can't read my name, I'm Councillor Graham Henderson, and I'm the Cabinet Member in Wandsworth for Adult Social Care and Health. And I'm one of the sponsors alongside Gillian for this particular work stream. And I was very pleased we had a meeting with John and one or two other people last week to discuss this. And I think eventually we did come round to a very sort of common approach and position on this. I don't want to sort of delve into a conversation now. We did actually have quite a lengthy discussion at the very beginning as to the role of sponsors, whether they should be champions. Now, the Health and Wellbeing Board chairs also met recently and quite separately. So I think this is an ongoing conversation, which I think we need to have. But I would certainly like to flag up that was certainly a major part of the conversation, which is precisely what we can actually do to bring something positive to this entire process. And there is a lot, I think, we can bring, in the same way as Ruth quite rightly talked about practice within local authorities in tackling modern slavery, as I think has been recognised. A lot of work has been done in relation to healthy eating within local authorities, certainly my local authority and many others. And it is a multifaceted topic. And I'm particularly pleased that the focus isn't just upon obesity. That's an important issue for many parts of our population, but it's also malnutrition, which I think certainly today has been relatively ignored, but which I think the cost of living crisis is very much brought to the fore. The other aspect which I think we certainly need to give some consideration to is eating disorders. Clearly, an essential element of health eating, but there certainly has, across the whole of London, been an exponential growth in eating disorders, particularly amongst young women. So I think this is another topic we need to focus on. Having said that, I certainly agree with Gillian's initial comments about focusing upon the things we can actually deliver, not being, it's great to be ambitious, but we don't necessarily need to be ambitious in the first or second year. We can actually pace that, and we need to identify things which we can do very effectively. So I'm very positive about this as a topic. I think this is something which has been ignored to some extent, and as the documentation quite rightly identifies, it's very difficult to actually prove that you are actually making progress, but equally, I'm certainly quite determined that we should make progress, and that this is certainly a topic which requires our attention. Thanks.
Graham, thank you for that, and I think you've repeated a point that was made by Yemisi earlier about actually some clarity around the role of the... so I think we need to take that on board. We need to work with you to see what would be the appropriate sort of guidance that we could produce around that, and what your aspirations are in terms of the role as well, so that we design something that actually feels like what you think you've signed up to. So we commit to taking that on board. I think the important things about this is, and I think you touched upon them, Graham, with some of your list there in terms of malnutrition, in terms of eating disorders. I think it's really helpful that we've moved away from the language of obesity in this, John. I think the team needs to be applauded for that, because it does capture those other issues that Graham quite rightly highlighted. Can I bring you in, Anne?
Thank you, Mike. So I'm very supportive of the idea of the whole system and everybody having a part to play. But I was reflecting back when we had that strategy development day in Wimbledon, and those who were there was a lady who stood up at the end and she said, "I am obese and I can't afford to eat healthily." And I guess my plea would be, and that stayed with me from that day, so there would be two things. One is, and I think you're right, it's about not being judgmental about some of this. But I think the other point is having some really practical thoughts. So if you met that lady in some encounter, what would you advise her to do if she can't afford to, and particularly in the times where cost of living, people can't afford to cook food from scratch and all the rest of it. I think we need to be have some practical thoughts as to what people could do to get to a healthy weight.
So I'll come to Gillian in a moment. I said I'd put you on the spot, Dino, and I think you're ready to to be under the spotlight now. So I think it'd be helpful. And then I come to you, Gillian.
Thank you, Chair. Yeah. So just on the approach for healthy weight, very much supportive of the initiative and the approach, and very much agree there with some of the comments just made around practical ideas, trying to make the right thing to do, the easy thing to do, which is always very tricky but necessary. I think also just on the principles of prevention, very much supportive of those as well. So I just want to highlight that. Regarding the active practice scheme, it's something that we're actively engaged in Sutton. I think in the infancy of being engaged in it, certainly we have some practices starting to follow the approach. It's basically trying to support the culture of reducing sedentary behaviour in staff, reducing sedentary behaviour in patients, increasing physical activity in staff as well as patients, and then doing that through various, also partnering with physical sort of activity organisations as well. So some practices who have started the initiative, for example, are running yoga classes within their premises, and it just makes it more of a highlight. It makes it really part of that cultural, part of the cultural change that is required. Actually, in our PCN, we're coming to discuss about taking this on as a PCN-wide approach. So I think it's a start. It's certainly something that could be one of the initiatives that helps us look at the end of the scale, which is more at the more the higher end of the obesity, let's say. I would concur with the observation of the lack of tier 3 services, though, is also something that we feel the lack of in primary care, certainly. And they will be my comments. Thank you.
Great, thank you for that. I think it's really helpful to hear that there are initiatives that can be taken and they make a difference. And they sometimes feel a bit like small steps, but they are really important. So I go to Gillian, then Nick.
Thank you, Mike. So I wanted to make 3 points. One, I'm the other sponsor with Graham, and I strongly support this. I was on the prevention group when we had the big strategy day, and John was there, and I think you were there as well, and we did get a kickback when we were talking about obesity, so I think we've got the language absolutely right, and I'm immensely supportive and will personally do everything I can. I just wanted to highlight a kind of worry area and a bit of positive information as well, because I think it's always important that we focus on what we can do, not what we can't do. It's absolutely the case that, particularly with the cost of living crisis, that there are people who can't afford to cook meals. They don't have the money for heating. And I was a member of the Cost of Living Commission that Wandsworth Council set up, and we had hard evidence of that. It's happening around us, and I think it's dreadful that people have to choose between keeping warm and cooking a hot meal, particularly in cold weather. Having said that, it is possible to make nutritious meals relatively cheaply, but you need the information and the expertise to do it. And many years ago in Richmond, when I was CEO there, working with public health and the voluntary sector, we ran healthy food projects for people in some of the most deprived areas of Richmond. And they were very successful. They've probably died out now because that's the nature of these things. But it is possible to do it, and we should be encouraged by that kind of experience, I think, because we have a vibrant voluntary sector in southwest London, and I think they can often get to people that it's harder for us to get to as statutory organisations. So I think there is some merit in thinking through some of those things, and actually encouraging schools to still teach cooking, because it seems to have gone out of fashion, and it seems to me to be a pretty basic life skill. So that's it from me. Thanks.
Gillian, thank you. And I guess part of me is also reflecting on when I was many years ago was a chair of a housing association in Wandsworth. It covered Tooting, and most of our residents were Asian. We used to run cooking classes for mums, which actually taught them alternatives to using ghee. You know, things, and they were peer-led. So there are small things that many of our partners could be doing in this space. I'll come to Nick, and I see there's a few other hands coming up, so I'll come to you. Piers, did you have your hand up a while ago as well? I'll come to you after Nick, Piers.
Thanks. I was going to mention the voluntary sector, and actually Dina mentioned healthy practices, but I think PCNs or primary care networks are perhaps you know, an alternative and maybe a better model to look at how this is done on a bigger scale. Integrated neighbourhood teams are, you know, the new kid on the block, something that lots of areas are looking at, and that's all about particularly voluntary sector, primary care, community care, working together on a number of different community level, neighbourhood level activities. We're working hard with our public health colleagues in Kingston, I'm sure others are too, to look at how voluntary sector organisations who are doing brilliant stuff in this area, and Brightbox is something which is doing something like that in Kingston, a bit like what you mentioned that Richmond used to do, maybe still are, that a lot of these things are done better by voluntary sector, and it's trying to tie in statutory services like primary care in with these organisations doing such great things. Not to say it's not our problem, to your point earlier, it's something we all want to be working on and making every contact count, which can be so powerful, but working together. And I think integrated neighbourhood teams are possibly a new vehicle to work together on this common goal. Thanks.
Really helpful, Nick. Thank you. Thank you. Piers.
Yeah, I wonder if I'm going to adopt being a bit of a critical friend here. I mean, I absolutely applaud the prevention approach and the much more positive language around this and so on. But if we're doing a systems thinking approach, I can't really. We've said what might happen at place. We haven't really said what if things are happening at place, what should happen at South West London level, and some of that thinking maybe we say that. The obesity drugs are going to be coming in and so on. I mean, that's one area, apart from commissioning Tier 3 and so on, that we perhaps really should be getting some clear thinking on, because otherwise we're going to be inundated with people who want, you know, think that anti-obesity drugs are going to be the answer, when we know that there are actually pretty more appropriate measures for many of them who aren't really in great danger with their health. So I just think that we need to develop this system thinking approach. What should we do at place? How do we share best practice? There's some great best practice in some pilots that Lambeth have run. You may have heard the BBC Food Programme, which highlighted some of those. They're pilots, but we can learn from them. And one of the things that you know, might work really well and so on is to actually look what's worked elsewhere. Obviously in Lambeth they were particularly targeting the Afro-Caribbean population. But what can we say should work? You know, places should really look at and so on. How do we actually do that within our places to our particular population groups? And is there research that we need to perhaps look to get involved with NIHR amongst others and so on, in terms of some of the problems we know exist across South West London.
Piers, thank you for that. And it just is by sheer coincidence that Sarah and I were talking today about anti-obesity drugs about 2 hours ago. But I think that is, yes, there are medical responses that we can and should be doing, but actually this is not about having a solely medical model. This is about what we as a whole partnership can do. I've got 3 people who have indicated they'd like to come in. I'm going to take those 3 people and I'm going to hand back to John so that we can stay on time, because after this I have to hand across to my co-chair and I don't want to squeeze her part of the agenda too much. So if I could go to Shannon, Nicola and then Iona. So Shannon first.
Thank you. I really welcomed the prevention principles, and having spent the last couple of years within local authority trying to embed our own prevention framework, I know that it takes a lot of time, persuasion, influence to really try and get you know, that systematic approach embedded into everything. So I just wanted to ask a question, which was more of a practical one, around what considerations have been given to the next stages in terms of embedding these prevention principles, so that the people who are redesigning services, writing policies, developing strategies are consistently referring to the principles and referencing them and being able to demonstrate where they have made reference to the principles. And, you know, in the local authority, I think it's taken about a year or so before we've been able to demonstrate that across all the directorates and services in the council. We now have, in the councils, we now have examples where actually people understand the conceptual framework and they've been able to apply it to practice. Thank you.
Shannon, thank you for that. And I think that's quite appropriate for us for putting on our ICB hats on the basis that we've made a commitment as a board to progressively increasing the level of funding for preventative work, actually having a framework for that, and that being embedded in all that we do in terms of planning and strategy makes a huge amount of sense. If I could come to Nicola next.
Yeah, thank you. I definitely welcome this. It's such an important issue, isn't it, that it really needs to be looked through every one of our services, everybody out there working in the system who needs to understand what we're trying to say about this, and through every person's life course. It's always important, right from birth right through to end of life, really, that your weight impacts on your health and well-being. I just wanted to agree vehemently with the idea of education of life skills in schools. I think that's a really important start for people. And with Nick about the potential for our local integrated neighbourhood teams that are in very early evolution, and about how we could use that to sort of, you know, make sure they're focused on this as well. But I just want to make a few links, really. Dental colleagues, if we're thinking about oral health in the under fives, do you know there's some sugar thing that goes on there, isn't there, which is going to have an obesity? Do we understand those links, and what could we perhaps do in our dental services? Our pharmacists are currently, our community pharmacists, looking at blood pressure and managing hypertension with medication. Well, we should be definitely taking a holistic approach there, shouldn't we, to make sure that our community pharmacies have the skills to be able to identify and make brief interventions to people who will really benefit from this. And then just as a GP, you know, I see the impact of unhealthy weight on people's lives every single day, and they're often most receptive to an intervention or a suggestion when they are feeling the impact of it on their health. But I think it should be easy, not just for GPs but for anybody in our system, to direct people into the right services. And I think there's quite a lot of services out there. We probably could do better with what's available and make it really accessible for people who are least likely to access it, and then make sure everybody else understands how to support them into that system, because I think it can be quite complicated to get to the right place with the thing that would benefit you the most, and it has to be very personalised.
Fantastic. And I think that taking it right down to neighbourhood level is a really important lesson for us all. Iona.
I just wanted to follow up on the point, I agree with so much what you've just said, Nicholas, as well, that Gillian was making about those local community sort of skills development and sort of food groups, cooking skills. Actually, they have re-emerged. I think, as you say, they were there a while ago. I think the cost of living, or actually the cost of surviving crisis, has really driven those to crop up again. So I think, certainly I know for Kingston, I'm not so aware for the other boroughs, but Sarah might know, you know, local cooking groups, community kitchens, food pantries, those sorts of things are blossoming, but also trying to create more of the skills alongside it, so you aren't creating a dependency culture. And there is a lot of interest, but as always, you've got to have those sort of 1,000 flowers blooming across southwest London. And whilst it is voluntary sector led, they do need support for that. You know, they do need our influence with maybe bigger providers, some of the infrastructure. So that partnership approach, and I think a lot of the inequalities funding in many areas is going to those sorts of approaches, really can make the difference. And I think that's where it's the what you can do rather than what you can't do approach that I think is more motivating when we're looking at such a big topic as healthy weight.
I will just allow one more contribution. Sarah, come on.
Thank you. I just wanted to reinforce what you were just saying, in the sense that I noticed as well that in the voluntary sector there's been an increase in healthy weight and healthy eating type of projects. Both established organisations like the Bright Box that but also Good Food Matters is a great example. So we've got some very good best practice examples in South West London that we could look at. So Good Food Matters is based in Croydon. They've got gardens. They've got quite a lot of space with gardens, community gardens, and they cook as well. And they've got a range of projects for the local community, which is quite, a community from a quite deprived area, but also what we call the asset-based community development, little projects led by residents. We've got an increase in fitness activities, and cooking as well. So it's definitely on the increase.
Thank you for that. So, John, I think you've been given loads and loads of enthusiasm for the approach that you're looking at. I think there's, without wanting to use, I think there's food for thought in this. Been planning to use that all night. But I think you can take it that we're very, very supportive of this approach, and I think we've got some good ideas for how we can embed this more widely in the system. Your final comments.
So, Chair, I'll try not to take up too much time. Can I just thank colleagues in the room for dealing with this in a respectful way? I think one of the things we've noticed in society and media, there's an attempt to blame and patronise particularly people who are poor for their health status. And I think what we've demonstrated tonight, it's a little bit more complex than that. So I think that is a helpful approach in South West London, because healthy weight is an issue for people who are, suffering from the economic crisis. But as I speak from personal, I have all the advantages in life, but I still can't walk past a kebab shop without wanting to dive in. And I say that so that we can all understand that this is difficult even when you have the personal advantages. If Charlotte Guan was here, she'd talk about communications and engagement. In fact, we've never had more information in terms of communications, whether it's brilliant TV programmes. You might remember the days of Jamie's and a school dinner. So I don't necessarily think it's always a lack of information. Sometimes it is about access to healthcare, or access to, dare I say it, affordable food. And what I would say to our elected members who've been really positive about this approach is just to think about, in every place in South West London, is somebody able to walk or get a bus to a location where they can actually access affordable food? Because that isn't always the case, and I think we understand that. But even if you can easily access affordable food, what more can we do? And I think that's the engagement challenge. So we do have an insights bank which Charlotte Guan is developing, which will tell us what our local communities do, because it's not a communications challenge as much as it is an engagement challenge. So how do we persuade people and encourage them to help them to do the right thing, which isn't always the same as doing the thing that you want to do, such as my case, diving into a kebab shop. So really helpful challenges here. Thrilled to hear that the prevention principles have been taken up, and that perhaps we can build that into some of our ICB planning going forward. So thank you.
Thank you all. I thought it was a fantastic discussion. It was a great presentation as well, so thank you for that. I'm very happy to hand across to my co-chair, Ruth.
Thanks, Mike. And I'm noting that there's been a bit of a theme this evening about how can we learn better from each other, how can we share best practice, how can we also share things that don't work. I think we're a little bit lacking in confidence sometimes about being open about the fact that we've tried certain things and they haven't worked, and understanding why. So that brings us very neatly on to the next item, because it is about racism and recognising this is an issue that we need to face head on. And I'm absolutely delighted that Sarah has taken on the lead, because I think it is so important as part of the inequalities work that we're doing that you're taking the lead on this, Sarah. So I'll hand over to you. Thank you.
Yeah, so I will introduce this, and then I will hand over to Melissa, who's just joined us at the end of the table, and she will give you a little bit of an introduction and go through the paper. I just wanted to explain the genesis of this particular work. This work actually has been going on for a little time in South West London under the executive leadership of Gloria Rowland, our ex-chief nurse. And when Gloria left us to go off to pastures new, we had a discussion actually as an executive team about who should take on the leadership of this. And I felt strongly that as chief executive, it was really important that I took a leadership role in this. So I am now the senior responsible officer for this work. What I would say is that there is a group that's in existence that's been meeting for some time that has partners on the group, which is from local authorities, from the voluntary sector, from health. But what we wanted to do when I took over was to see how can we give this a higher profile, how can we ensure that we get all the partners on board with the work that we want to do, and how do we develop the way of working that we want to have across South West London. So Melissa very kindly agreed to support me in this work. Melissa is our Equalities, Diversity and Inclusion lead. I also just wanted to say, before Melissa sort of launches into the work that we're doing, that this is not about saying people aren't doing lots of work already. They really are. All of the health organisations, all of local authorities I know do huge amounts of work on this, as we do. But actually there is so much more that we need to do, because otherwise this problem would be cracked, and it really isn't. So this is about how can we bring this together as a group of leaders across South West London to see what we can do to impact. What I would also say is, not only am I asking you for your commitment, the reason I brought this here is because I think as an ICP this is an important piece of work that we should all commit to and receive regular reports on and take away to work with our colleagues on. So I am asking for quite a lot of commitment for from everybody around the room as part of this work. So I'll hand over to Melissa, who will give you the overview of where we are and what we want to do. If she can get her thing working, that's it.
Sorry, I didn't know which button to press. So, good evening, everyone. So I'm Melissa Berry. I'm the Programme Director for Diversity, Equality and Inclusion. I'm going to take the paper as read by everybody and really talk about the importance of us achieving real good anti-racism work, which will lead to pro-equity. So most times when people hear anti-racism, they think about that on an internal basis and think, actually, are you calling me a racist? And it's way more than that, because we need to look at the systematic impact that racism has on our healthcare, local authority and in the voluntary sector organisations. And actually every item that you talked about already beforehand, it feeds into everything, and really that's the ambition of making this a system priority, because Sarah's right, we are all doing individual work, but I think the real important thing together is A, to learn what's the good practice that's already out there. Secondly, how do we come together and make this a real priority? Because if I'm honest, I've worked in the equality and diversity space, I'm going to show how old I am now, but for nearly 20 years, and I feel the conversations sometimes haven't progressed, and we really have an opportunity to do something different, and that's one of the things that I think is really important about how the ICP can take this forward and be involved, and how we can collectively come together to actually move the needle. And if I think about myself, I don't believe in that we might not see massive outcomes straight away, but actually for the generations that we're talking about of the future, we want to create something where actually we can stop talking about racism and understand that this has been constructed, basically. So it did start off as an ICB priority, and I know everybody's doing work in their own local authorities, but I think thinking about how we take that forward. So we've already linked in with the work that the Mayor's doing across London, so lots of local authority partners and voluntary sector partners are part of the LARC. We are also part of that LARC. The LARC, so that stands for the London Anti-Racism Collaboration for Health, and that's a peer collaboration thinking about related health inequalities and how we support our patients and communities. And I think there's a real advantage as an ICP, even as an anchor institute, how we get people into employment. There's so many things that we can collectively do. So one of the things that I will highlight is our core principles that's in the paper. So as a person who's worked in this space for a long time, we want to be ambitious. We definitely want to go beyond pledges and commitments. I talk about this all the time. We love to sign up to a pledge, but actually taking real meaningful action is where we need to be at. We want to align with the good practice that's already taking place. So we're in a real learning stage of actually what is happening, what's going on. I mean, we've been looking at the work that Hackney Local Authority have been doing. We've looked at some of the work that's happening in Croydon, also the Welsh Assembly, the approach that they've taken across police, health and housing, to really understand how we can move these interventions. We want the interventions to be community driven. We also recognise the community is tired of hearing false promises, and so it's really looking at how we can kind of move that forward and wanting to become South West London anti-racist health and care system. And the two parts of the work that have that we've committed to is around the community insights work, but then also how as partners we can do some more in-depth work around racial insights. So we've committed to working with FLAIR, which is a data intelligence organisation, which I'll be sending out expressions of interest to all of the organisations across South West London to see who would like to be involved in that piece of work. So voluntary organisations, local authority and health, basically, so that we can look at what we're collectively, our staff are telling us, but then look at what our communities are telling us as well, so that actually we come up with something that to me isn't just about a piece of paper, it's about how we take this forward together collectively. So I always say to people, this might fall, Sarah, as the responsibility as the SRO and me in leading this work, but actually we're all going to need to sign up to this piece of work. So I guess my ask is for us to have a discussion around that. I'm going to take it that you'll all be supportive, of course, and how you want to feedback and how you would like to be involved.
That's really helpful, Melissa, thank you. And these are issues that are at times uncomfortable. They are difficult to talk about. It's really important that we have the trust and confidence to be able to discuss this amongst ourselves and to be absolutely honest about the fact that we've been talking about this for a long time, and yet it doesn't seem that much has changed. So I think we really need to get to understand what it is that isn't working and why. And I'd like to suggest for starters that this has to be core to what we're talking about in the workforce stream, because we need to set our own house in order. Otherwise, who are we then to tell other people what they should be doing? So I really do feel very strongly, and it's a conversation we had at the board as well, noticing the startling lack of diversity on the board, slightly better on the partnership, but still not nearly good enough. I do think that we need to honestly ask ourselves what it is. What are the obstacles that are presenting it to mean that our workforce isn't as representative as local community as it should be? We know that our 6 South West London boroughs are increasingly diverse, which is a great thing. But I think especially as you go up to the higher levels of management, I would argue that certainly they're not as representative as they should be. And we think, so my question to you, Melissa, and then I'll open up to everyone, obviously. What are we doing with our own workforce to truly listen to people who are working for our organisations and understand where those obstacles are and what we should be doing differently?
So I'll take that question. So in the NHS we have a number of a mechanism. So we have the Workforce Race Equality Standard. In local authority, you have something similar. And I think, so I'm just starting to work much more with the local authority leads around EDI. And one of the things that I bring the NHS part of that together is that we'll bring them together more collectively and work, because one of the things about being an EDI lead is generally you are one person really trying to sometimes move that on your own, and having that peer support is one of the things that we want to create. I think our staff also have told us for a long time that they're experiencing this. We all have the staff survey. We all have avenues where our staff feed in how they feel and how that impacts on them. And some of the conversations that I've had, one of the things that I picked up on was when a staff member, and it was really stuck with me in my head, said, "I feel frozen to challenging." And I went away and I felt quite sad, because actually we have a responsibility, all of us, to kind of, you know, not walk past, not be a bystander of when we hear things that might be racist. And I don't just mean people making racist comments, but even in the way that we commission our services, have we really thought that through? How do we look at that? We need to be taking an anti-racist approach to all of the things that we do, and how we kind of embed that. So sometimes, you're right, people are really uncomfortable in this situation. So one of the things that I want us to do at a South West London level is actually have a shared understanding of what does anti-racism mean, because I don't even think we have that, to be honest, Ruth. So I think some of that work is what we need to embark on collectively together. I hope that answered your question.
It does, and there is an awful lot of good practice happening across our 6 boroughs, and I think we need to be able to share. I don't know if you've had any thoughts about how we can make that happen. I know what's happening in my own authority. I've got no idea what's happening in the other 5. I'm sure there's a huge amount of work, and it goes back to what I said at the beginning. I really think we need to get better about sharing what works and what doesn't, because otherwise we're just reinventing the wheel over and over again.
Of course, and I'm not into reinventing the wheel. I want us to make the wheel better. So there will be some of us bringing a collective and sharing together, definitely.
Excellent. Who else would like to come in? Yes.
Hi, I'm Annette from Croydon. Actually, it is to be brave, I think, and have the conversations and actually move the wheel. because we keep going round and round on this. So recently I've had a conversation around sectionality, and it was new to me. So and I was it's about and it was with a group of black women. And they wanted to meet me as a senior leader to have a conversation on how it feels to be a black woman in the workplace within their own society. And it was really a fantastic conversation. But where do you bring that conversation to move it on? It was about their opportunities at work, how they can move up. So I've given it back to them. They are going to lead this. They are going to bring this forward with me to look at how we can bring it further and wider. You know, so what came out of that is Black on Board. Okay. So we've had some work done with an organisation looking at working with women. And that's only one piece of work. There's a huge amount of work going on in every local authority and all our contracting. But actually, how do you make it real? How do you really make this real? Because we can have documents, we can have papers, but how can we actually make it reality?
And I guess we've been doing positive action programmes for a long time, but it's actually the impact that those positive action programmes have at the end of it. So sometimes we go through those positive action programmes and it enlightens people, and then we do nothing with it. We still don't give them the job. So actually there's two parts to that. So I'd love to talk to you offline. There's two parts to that, because it's also the work that we do with our leaders who in the future need to be employing those black women and supporting them to go further in the organisation, because it's really easy to put it on I always thought, me and Sarah have many conversations where I say this is not a black problem. So collectively we need to think about that. So our role and responsibility as leaders is really imperative to moving that needle. And it's really brave of those staff to come and have that dialogue with you. And actually it's about how I think those stories are shared in a really psychologically safe way. That's the other thing that's really important to remember. So I'd love to talk to you offline.
So this is another reason why I wanted to lead this locally, because I think it's really important that actually I take positive action, just as my team will need to take positive action and others need to take positive action. It is not about saying we're going to put our black and ethnic staff through more training in order to get them into a better place. Actually, what we need is those champions and that support for them throughout the organisation, so that we can ensure that they are given the opportunities that they absolutely should have and need. So, you know, that's what we need to do, I think, as a system. And some of it is about what's the good practice and what's worked. I think what's worked is really, really important, because we do a lot, actually, but a lot of it doesn't work, to be absolutely honest. And it's how do we really make this real and deliverable and, you know, supportive of those wonderful staff that we have that can be fantastic and can actually add so much value to what we do, which I think is really important, because that diversity of thought and difference is really important to us achieving what we need to do for local people.
I think that's absolutely right. Who else would want to come in? Yemisi.
Thank you, Chair. I just wanted to commend this work. I think it's really important, and from listening to the conversations, it comes across incredibly authentic, and I think people will really appreciate that. And also, I'm really hopeful that it's sustainable. So when we all move on, actually the work that we have done will continue after us. So congratulations for where you have got to with this work. And yes, we talk about all the challenges and the problems that we know exist in the system already. But you're absolutely right. There is a lot of best practice out there, not only in South West London, but in other parts of the NHS, and I'm sure local authorities as well. So I think it's about us opening up and actually being honest with ourselves as to what's worked, what hasn't worked, and that way we can shift that dial a lot quicker. And yeah, I'm fully supportive, and in any way I can help. Thanks.
Thank you.
That's really helpful. Thank you, John.
I think it's worth highlighting that I think it was last year there was a rather ridiculous assault on the role of EDI in the NHS, which was promulgated by the usual suspects, and I think we know who they are. So I think it's really helpful we're continuing to talk about this, because if there are people watching this, citizens, neighbours, colleagues of ours who are annoyed about us talking about this agenda, it means to me we're doing the right thing by talking about it. We will have a cohort of citizens, neighbours, family, friends who won't want to do this because of innate views that they have, and we have to work to challenge them. But there's also another cohort of people who will want to help and will want to do something different, but perhaps they don't know how to do it because it's an area that scares them. They feel they might say the wrong thing or do the right thing even though they're coming with good intent. So there are opportunities there. One is probably a little bit more difficult to challenge, but that's why we must challenge it, because we have a problem, and we know we need to do something about it. And I say that as somebody from an Irish background, and I know that Irish people always haven't had a good experience, but I also know we've been perpetrators of racism, particularly in our global exploits. So I'm mindful that we can be victims and villains in this from an Irish perspective, and once everyone has that same sense of honesty, perhaps we can move forward positively on it. But we have to remind ourselves, particularly in the NHS, that if this doesn't matter, well, then nothing else is important.
That's really great. Thank you, John. And I absolutely share the sentiment. One of the things I've learned over the years in my role is that however hard I try, I cannot put myself in the shoes of someone who has grown up in very different circumstances. I don't really know what it's like to be living in this world as a black woman, and certainly not as a black man. So I think it is very much about listening, learning, sharing, but also something I'd like to promote, we're doing in Sutton, possibly other boroughs are doing, is reverse mentoring. So rather than someone who wants to have a career coming to learn from someone who's higher up, the chief executive of Sutton Council, for example, is an absolute champion of this. She is being mentored by people who live in a very different space and a very different world from her, and she tells me how much she's learned and understood from them. And I think ways of truly listening and understanding what it's like to be a person in this world who has grown up in very different circumstances. I think it's important, and we need to be able to challenge ourselves. I can see you nodding furiously, Melissa.
So I think many people might have heard me say this, is that I'd really like us to go beyond reverse mentoring, because for me it's more about the sponsorship, because sometimes there are what reverse mentoring does, and there are many positives to it, it gives more to the person in the leadership position, because they now know someone who's from a black or ethnic minority background. But actually what I really want to create is something where we're opening the door, we're sharing our contacts, we're sharing, so the programme that we've running, actually I've called that System Leaders of the Future, but it's actually where we're opening our black book, right? Because at the end of the day, we all have a journey how we've got to this leadership position. And I'm sure it wasn't easy, it wasn't one straight road for everybody. And actually by opening your contacts and going further than reverse mentoring, you're not just having that dialogue with that person, you're actually helping them get to where they want to go and the things that they want to achieve. So I always encourage people to go one further than just reverse mentoring. And Karen and Sarah will both know that, because I'm always talking to them about actually power in the story sharing that we are sharing. There's a shared understanding sometimes between women. Yes, the experience for black women is different. The experience for Asian women is different. It's different for everybody, but there are shared commonalities that we all share when you're on a leadership journey. And so it's taking the time to understand that. And so I think when we're looking at reverse mentoring, we should really be thinking about the sponsorship mentoring piece to actually also be helping people get to where they want to get to. And then, like I think I said, going beyond the pledges and commitments. But it's good to hear they're doing that.
No, and it's great to share, because, yeah, thank you for helping me move on so I can understand as well and make progress. Dina.
Thank you, Chair. Again, very supportive of the anti-racist strategy and the work, the commitments, and a lot of the comments you just made there as well, Melissa. I'm wondering, in terms of helping us to move the dial, I think the needle along, is it something that we could consider in terms of incorporating an indicative trajectory of where we might like to see to measure ourselves going forward? In fact, what would we think is a place we'd like to move towards? What difference would we like to see, for example, with our workforce, with our populations, and really maybe this strategy, maybe incorporating some sort of tangible elements that we can sort of use to measure or monitor our own progress?
So you mentioned, Melissa, the flare work. I think this is, because this is going to be our baseline, it will give us a bit of insight into what's going on within our system. And then we've got that, I think, over a period so that we can reassess over 3 years what we have done. So we will take a baseline and we can see whether or not we've actually improved based on what we have done. I would also say we do also measure, I'm sure you do in local authorities as well, we do measure things like res data within the NHS. It's good that we are measuring something, and it's good that we are able to see that, and we also have things like staff surveys and so on, but sometimes I think we're obsessed with those measures rather than doing the right thing. So we just need to be very careful, I think, about what we're measuring and how. But we absolutely have the intent to try and do something, particularly with the work from FLAIR, which is considered best practice, and to involve all of the organisations in the system in that. So we would like people to put their hands up for that. How many places have we got? We've got
up to 15,000 respondents.
15,000 responders.
We've got up to 15,000 respondents, but what I would say is if your organisation decides to go down this road, that we need to have somebody who takes on that road. So if it just tells you what you don't like, sometimes taking the lid off Pandora's box feels uncomfortable. So there's going to have to see some work. So if you sign up to be part of that FLAIR project, it will be that we will be involved in terms of what you see, what's the outcome, and what are you going to do about it, because there's no point in asking staff what's their experience, not feeding back and then doing nothing with it because we don't like what it says. So that's the really important thing, and that's why we're doing an expression of interest for people to think about that before they sign up to doing the FLAIR work.
And Dino, that will be open to general practice, and it will be open to the voluntary sector and others, so So Dina's going to put in an expression.
Yeah, I don't want to put you off, but I just want us to know that if we do it, that we need to do it properly. And yeah, I'm a bit like a person with a drum. So yeah.
Could you just say a couple of words about the FLAIR project? Because I saw some
sure.
puzzled expressions. I think people might like to understand a little bit better how it works.
So FLAIR is a data intelligence software. So they work across industry, so they've worked with National Rail, different healthcare organisations, local authority, banking, insurance. And what they do is they have a set of questions, that is like a data insight question, to test what people are experiencing around race and racism in the workplace. We can tweak those ever so slightly because sometimes it might say words like customer. We can tweak it so it reflects what we do in terms of the ICP. Then that goes into a large data software base and gives you a benchmark compared to all of the other industries. So, you go into that, but then we get might have health or local authority. And what that does then is produce a back-end report to give you a picture of what staff are experiencing in your organisation and what staff say, but in an anonymised way, so you won't know where that information or intelligence has come from. So that's a really important thing. I think if we're going to ask staff, they need to feel protected if they're sharing their experiences with us, right? Because we know there is a lack of trust, and it's brave to call out these things. So that in a nutshell is kind of what FLAIR is, but I can send through a more in-depth presentation about FLAIR and when the expression of interest comes out, and I would encourage you to be a part of it.
Could we attach that to the minutes so that we've got that link, because I think a lot of people are looking very interested, which is great. Sarah, do you want to sum up?
Yeah, so we are looking for a commitment. What we had done, this work has been going on, I should say that, but it hasn't really been at the forefront, and it hasn't been discussed in an open sort of public meeting. And so I discussed it at our ICB, but I felt very strongly that because we want to work across the system on this, that we ought to have a bit of oversight in the ICP. So we are actually asking that. We're asking for your commitment to this anti-racism approach, but we're also asking that we come back and report on where we've got to, and you kind of act as our sponsors around this work as well, because we think it's important that it has that level of kind of support across the system.
And I can hear real support from everyone on the board for this piece of work, so thank you for that. And absolutely regular updates I think would be important, and also people feeling confident to be able to share what they're doing as well. I think that's really great. Thank you.
Thank you.
Thank you.
Excellent. And now we're coming to, I think it's the final item. We've talked before about opportunities for all members of the partnership to be able to influence the forward plan. So Karen's going to talk us through what we're planning and opportunity for people to ask questions if needed. Karen.
Thank you. So just to remind the board that we had a forward plan in draft form. but there was a session that we felt we needed to talk together and agree the agenda together. That happened in November, and you've got the notes of that session in the pack. As well as part of that session, a set of principles were agreed around the way that forward agendas and kind of conversations should go, and they're also here. I was just going to spend a minute on these ones. So the principles on our kind of agendas should be that actually our focus is on the 4 core purposes of the ICS, and they are on page 96 of your packs. That they should really be action focused around the delivery and the strategic priorities that the board has set, but also that we give the opportunity for topical subjects when it's right to do so, so that we also have a kind of a more agile agenda. That we shouldn't dominate as one partner, that actually this is a partnership and therefore lots of conversations and lots of important things going on behalf of us all. That actually, and I think today has demonstrated it, rather than actually receive information and have receive reports and listen and be passive members of a board, actually a very strong view around presentations being kept short so that there's plenty of time to discuss and hear the wealth of experience that sits around this table. And there's others, but I won't go through them. But important to say that's what this board said was important when we set the forward agenda, and how we then all adapt that as we move forward. Within the pack as well, there is the forward plan that takes us through, and you'll see in April our focus is on children and young people. So the in focus item that we had on healthy weight today, we want to have a conversation around children and young people, and also mental health, the investment fund, and then hospital and primary care strategy and one public estate. So a huge amount to look through. That's what we've done with the information not only we received on the day, but also then how we build that into a forward plan for the board to talk through as we move forward.
And there's going to be a focus on each one of the work streams as we go through, isn't there?
Absolutely.
So we've got that opportunity to have a more in-depth discussion. Yona.
Thank you for that. I think it's really helpful. It was useful to have that forward planning meeting. I wondered whether to strengthen it, we could include the outcomes framework that John presented at the last meeting as a sort of theme between each of the topics. Some of them it might come naturally, but I think it would be helpful as part of that planning to mindfully think, how are we bringing that back to see what the progress is looking like, what the challenges are like. So if we could include that, that would be good. Thank you.
Good suggestion. Thank you. Anyone else? Any comments on the forward plan? Don't see anyone indicating. In which case, thanks, Karen. That's really helpful. We'll keep it obviously on the agenda each time because stuff happens, events happen, and it could well be that other things crop up that we feel need to be added on. But I think we've got a really good framework here. It's taken us some time. It's taken us over a year to set up the partnership board to understand where we want to go. And I certainly think that the seminar that we had, the workshop in Wimbledon, was a game changer because it really helped to bring everyone together to think about what actually matters to the people living in our area and how we can make a difference. I do think where we started saying we need to focus on what will actually change things is really important. Some of this is so big, it's so difficult, and we've been trying for such a long time to make a difference. I think we're right to be ambitious, Gillian, absolutely, but to also recognise the limitations. It's us. We don't have huge teams of people beavering away behind the scenes, however much we would like that to be true. So we'll do what we can, but there is so much going on across our area. I do think we need to get nimbler and cleverer about bringing some of the work together and just understanding who's doing what and how we can learn from each other. But I think we've got huge potential going forward, and I think it's really exciting. So we're being asked to note the forward plan, and as I say, we'll continue to discuss it as we go forward. I haven't been made aware of any other business, so I am going to bring the meeting to a close. I've also not been made aware of any public questions. Oh, Sarah, beg your pardon.
Sorry, I keep thinking at the idea of reverse mentoring. I was thinking it's maybe something that the board wants to do. You know, we could all do it, you know, as board members, as one of the pledges, you know, or kind of moving forward.
Can I suggest we have a discussion with Melissa about what we could do and how we could, so perhaps we have a chat outside about what would be best to do, because we've moved on from reverse mentoring to sponsorship, which is kind of slightly different, and it might be that we have a discussion about that and what that means.
I just wanted to say that I already do, as Melissa described. So I hope it's a two-way process. I've learned a lot, but the deal was that the the person that I've been working with, and it's the second person. So I just think we need to understand the baseline before we start committing to things that some people will already be doing. Thank you.
But let's come back to that. We have committed to regular updates, so let's come back to that and think about sponsorship and the added value that it provides. But thanks for that. Absolutely. Haven't been made aware of any public questions. John, I keep trying to close down the meeting, but we just want to keep going.
You do, Ruth, but it's the Irish and me, we can't stop talking. Can I just flag measles to the partnership, please? I see everyone nodding their heads because it's been all over the media for the last few weeks. I use the words terror advisedly, but it's one of the things that actually really frightens me as a medical practitioner. There's lots of reasons why measles vaccination rates have fallen off over the last 20 years or so, so it's not just a recent thing. Obviously there's a medical individual who's to blame for that, but I won't mention his name. But I would say just to parents or carers or people who worry about getting their children vaccinated, I do understand that, because 22 years ago when we were immunising our eldest child, we had the same conversations but went ahead and trusted the professionals that vaccination was the right thing to do. So in terms of advocacy, medical and public health colleagues are working really hard. We have an action plan in place. We think this is a long-term piece of work in response to the short-term challenge or crisis that we may face. But I would just encourage particularly our elected members and colleagues to think, what can you do in terms of helping us with advocacy around this? Because it's a huge challenge in schools, it's a huge challenge in universities, and if this does take off, we are in trouble. So anything that we can do to prevent a preventable illness would be much appreciated. So apologies for not flagging that in advance, but
That's
I think it's a missed
fine,
opportunity.
John. It's really important, and this is the place where we should be picking up things that are current and important. What I would say is, let's take the learning from the COVID pandemic and the importance of champions and how we're able to reach into communities with trusted voices, and let's think about the very good work that Charlotte Gorn and her team did around vaccine hesitancy, and think how we can then use it again with the issue around immunisations, because Mike's just showed me some data and it is really quite alarming. So let's not be complacent and think about how we can take that learning about trusted voices and make sure that it's part of everything that we do. Thank you for raising it, and please, under any other business, if there are current issues, emergencies, crises, things important we should be talking about, this is the place to make it happen. But I'm going to close down the meeting now, and thank you all for your time.